I'm an advanced practice registered nurse at University of Texas MD Anderson Cancer Center. I'm excited to be presenting at ONS Congress for the first time, and I'm presenting within the advanced practice tract on unlocking the code, incorporating genomics into advanced practice nursing, which is definitely a hot topic and an important topic that we're hoping to get more exposure and information out there for both nurses and advanced practice nurses. Genomics really is taking off and helping us to personalize cancer care by giving us information about a patient's tumor. Genomic information can help to identify genomic driver variants that are within the cancer that can help us to make treatment decision making. We can also learn information about a patient's hereditary cancer risk, and so genomic testing can also help us to make that determination if they would benefit from risk reduction strategies or other interventions. So my presentations will basically talk about different applications of biomarkers across the cancer care spectrum, anything from cancer susceptibility, so again, looking at that hereditary cancer risk, to predictive biomarkers, which again help us to match appropriate therapies to the patient's genomic fingerprint of their tumor. There's also a role for prognostic biomarkers in helping, in some cases, risk stratify patients to determine if they have more indolent or aggressive disease, and that may also help with treatment decision making. And lastly, I'll talk a little bit about pharmacogenomics and how, patients' genetic makeup can impact how they metabolize drugs and how that could affect cancer therapy selection or dosing as well. So I think people tend to think that biomarker testing, there's increased awareness of the importance of biomarker testing, especially in the treatment decision-making realm, but I don't know that we are getting enough information out there that there are so many applications of genomic testing that really can impact patients who aren't even diagnosed with cancer to, all the way through the cancer care spectrum. So hoping that people leave the presentation with a better understanding of that and then can go on to serve as resources for the patients that they care for and help them to understand the need for testing, help identify eligible patients who should be tested, and advocate for patients to get testing as well. So. It's hard to keep your finger on the pulse because things are changing so rapidly within the biomarker testing realm. So, especially in this setting of predictive biomarkers to match patients to appropriate therapies, biomarker testing in its early forms was limited to patients who had advanced or metastatic disease and would be on these therapies. But we are seeing there's been drug approvals for patients with early stage disease. I work in lung cancer care, so patients who have early stage resectable lung cancer, there are certain indications that they would get targeted therapy following treatment depending on if their lung tumor has an EGFR variant or an ALK rearrangement. So there's really a greater need to test across a larger population of patients, as opposed to in the past when it was more limited to patients with advanced disease. But I tend to, knowing your resources is key as far as how to stay up to date with, testing recommendations. NCCN guidelines is constantly being updated, and it is my go-to for keeping up to date with current testing recommendations. Oncology Nursing Society has great genomic resources, including their ONS biomarker database, which has up-to-date information on clinically relevant biomarkers for multiple disease sites. I think as it stands, it's over 350 biomarkers included currently, and it's consistently being updated to include up-to-date information. It has implications for testing. It has testing technologies that are recommended. It has any relevant targeted therapies for a given biomarker. So it has really important information that a frontline nurse can quickly go to and get a quick overview of what's important and relevant. If you're taking care of a patient that is found to have a certain genomic variant and you're not familiar with it, so it's a great resource. It's If you're an ONS member, it's all you need to do is log in to access it. If you're not an ONS member, you can also access this. You just need to set up a free account. So we really want to make sure that people are aware of this resource and can access it to help provide better genomic informed patient care. There's been a great selection of genomic resources aside from the biomarker database that have been developed through ONS in the past several years. With the direction that everything is heading as far as personalized medicine, we want to give oncology nurses the support that they need and the education that they need to be able to deliver informed care and be a resource for their patients. So I definitely encourage you to visit the Genomics Learning Library, which is housed in the ONS website. There are anything from next generation sequencing toolkit to help understand the role of next generation sequencing in genomic testing. There's resources on germline and somatic variants and how those a better description of those. There are hereditary cancer sheets. So there are countless resources, and I just would encourage any oncology nurse to explore that area, look for resources that align with their current clinical practice, and use it to, again, be able to provide better education and informed care for your patients.